AI really has an opportunity to remove the artificialness in that interaction between the patient and the physician or the clinician. So we talked a lot about innovation and innovation partnership ecosystems and some of the work that we're leading in Advocate Health in creating ecosystems of innovation, where we're bringing in innovators and large tech companies and pharma and robotic companies, but also researchers and clinicians and medical students and community and investors into this rich ecosystem where we're making that magic happen. Advocate Health is one of the largest health systems in the United States, but we're really focused in on making sure that we're able to serve the needs of our communities in all of the populations that we serve, and also at the same time really move care transformation forward in innovative and transformative ways. So we're focusing specifically on a number of what we're calling national service lines. So oncology is a big part of what we're continuing to innovate around. Heart and vascular, cardiovascular health is really important, and we're trying to standardize the practice of care across the broad populations that we serve. And then neuro and neurosciences, that's really important for us, and we're trying to make sure that we're able to leverage the power of artificial intelligence and agentic AI to really drive forward with the transformation elements of all of this. And then last but not least, we're really focused in on health at home and wellness. So when you think about what we've been able to achieve at Advocate Health, we have the largest hospital at home program in the country. And we're continuing to grow that program, but also focus in on not just acutely ill patients or patients who've been discharged from the hospital from a chronic illness with remote patient monitoring and with devices and with AI, but also on patient populations that might look like you or I, where we're the worried well, as we call them, right? And how do we leverage the power of digital and data and nudges to make sure that we continue to maintain ourselves in that circle of wellness? I say that it is time for us to elevate ourselves as an industry from transactional healthcare to experiential healthcare. It really is about experiences. When you go to a bank, it's the experience. When you go for a movie, it's about the experience. Only in healthcare is it about a transaction. It's about a billing code, a visit. It's about a transaction between you and a clinician or you and an institution. It really needs to be elevated to experiences. So as a physician, as a clinician, it's about the experiences that we have in bringing back the joy of medicine.